You cut the carbs, you watched the scale drop, and still feel wiped out? I've seen that story 1,000 times. And it ends better when you add the right 3 supplements. We'll start with number 3, omega-3. Your eyes, heart, and brain need these super-powered fats. They enrich the cell membranes and they quiet chronic inflammation. You might not have missed them before going keto, but add them to your ketogenic body and watch the scale drop again and the brain clear up. As a seasoned clinician, it's really difficult for me to pinpoint what omega-3 deficiency looks like. It's much easier to watch a patient dramatically improve after 3 to 4 weeks of supplementation. Let me show you how difficult it is to spot omega-3 deficiency. Do you have a sandy feeling in your eyes in the afternoon? Or does your skin feel dry? Or maybe it's the slightest stress seems to mess with your mood and your sleep. See, it's too vague. That's everybody, isn't it? Skip the guessing. Test yourself at home. I really like this company, Omega Quant, where you can prick your finger and send the sponge in and you get your results in about 10 days. You do not need to ask your doctor for this. And I test myself a couple of times a year. You can find that link in the show notes, but you should get a result that is at least north of 8. That means 8% of the fats that you use to build cells come from this incredible resource. 90% of Americans have less than 6%, and that is at really high risk for cardiovascular disease. Remember, these fats are essential, meaning you can't make them, you have to swallow them. So eat 4 cans of oily fish per week. Yeah, think smash, salmon, mackerel, anchovies, sardines, or herring. Or you can supplement, which is starting with 2,000 milligrams of a high-quality fish oil. My best advice is to push past the burping whenever somebody starts on either sardines or fish oil. Your bile production is not in shape, it's in training, and that burping will go away. Up next is number 2, which is magnesium. If you're tired on the ketogenic diet, I will blame magnesium until you do this. Yeah, magnesium is a metal and you need it to survive. Like a spark plug, you plug this metal into 300 reactions to make energy flow. Magnesium turns food into power, mushy brains into thinking ones again, and flabby hearts into pumping machines. Magnesium boosts libido and makes more sex hormones and stabilizes blood sugars. All of that. Unlike the vague or mysterious symptoms of low omega-3, magnesium gets the justified conviction for causing all of these problems. It causes muscle cramps and poor sleep and constipation and headaches and palpitations and numbness and tingling and tremors and seizures and headaches and migraines and high blood pressure and severe fatigue, personality changes, even trouble swallowing, delirium, confusion, or psychosis. Despite this horrific list of symptoms, half of Americans are low on this. And if you do keto, we make it worse. Yeah, we increase the amount of magnesium that you pee out. And if you're already low, those symptoms become part of the reason you can't do keto. And if you come to me asking for my professional affirmation that the cause is your low magnesium, I won't check a blood test. I will send you floating. Yeah. 5 floats in about 21 days for most of my patients does the trick. It dumps a bunch of that metal back into your circulation without side effects or toxicity. But then we use supplements because floats are kind of inconvenient. So my favorite is magnesium L-threonate. And the L-threonate is the only form with the evidence that it raises magnesium inside your brain more effectively than the standard salts. That matters for the depth of your sleep, the resilience you're dealing with stress, your attention span, and even headaches. When I'm fasting, I take even a bit more because I know I'm losing more magnesium on those fasting days. Finally, my number 1 supplement that I recommend and I take is vitamin D. Vitamin D behaves like a hormone and pulls the heavy weight of an essential nutrient. You can't make it. You have to get it from an outside source. And it does all kinds of things. It builds bones and teeth and strengthens muscles. It calms all that runaway inflammation and then steadies their blood sugar and their blood pressure. It sharpens their thinking and lifts their mood. That is a lot of win for one little lever. And when you have that many levers, you might guess that the symptoms that it improves seems to be for everything that goes wrong. If you have draggy afternoons or you have a low mood, or maybe winter blues or brain fog. Maybe you just think my processing seems slower, or I can't seem to respond or bounce back from stress as well. even that their sleep doesn't restore them. And isn't that everybody? Doesn't this sound like the list that everybody would complain of? If that list rings a bell, check your vitamin D. So here's a couple of things. There is a fast way that your body uses it and a slower way. The fast way is when the sun hits your skin, it takes cholesterol, converts it to something called D3. Liver converts D3 to 25-hydroxy vitamin D. This is what you measure in the lab. The kidneys and many tissues convert that into an active hormone. Active vitamin D enters the cell, it docks in the nucleus, and flips on the gene programs that run, repair, immunity, and metabolism. Simple chain, huge payoff. Test, then target when it comes to vitamin D. Use another at-home kit in the show notes to test where you're at. I test patients 2 to 3 times a year, and I want them to hit a number of greater than 50 nanograms per milliliter. If you're repairing from an illness or an injury, I prefer they live between 50 and 80. When it comes to supplements, stack it smart. The simple protocol is this. For vitamin D3, 5,000 to 10,000 international units with a meal every day. Magnesium is 200 to 400 milligrams of elemental magnesium in that well-absorbed form, and take it in the evening. Omega-3 is 1 to 3 grams combined of the EPA plus DHA with your largest meal. Eat fatty fish at least twice a week. Pair this with the basics. Real food, less than 20 grams of total carbs, add salt and electrolytes, and get consistent sleep. You can get distracted with all these measurements, but the real key is measure that vitamin D and omega-3 twice a year. And then keep an eye that glucose stays down and that ketones are on the rise. That will give you the honest chemistry on how I take the keto from a diet to a durable metabolic upgrade, and why my patients can feel it. Now keep going. I'll show you the 3 best ways to get into and stay into ketosis.